All right, good afternoon, everyone. My name is Nikki George. I'm the nurse navigator for the joint replacement program here at West Bloomfield. I work with the shoulder surgeons who have sent you here today, Dr. Moo, Dr. Kolowich, Dr. Rill. Today, my job is to go through the day of surgery with you. So I'm going to try and inform you as much as I can what's going to be happening each step of the way, so there's no surprises. There's nothing worse than going in for a surgery or a procedure and just not knowing who's who, what their role is, what are they doing, what are they sticking on me, what's going on. So I'm going to walk you through the whole pathway. I did follow Dr. Moo one day the whole way through, so I know exactly what happens. After my presentation, the occupational therapist will be here, and I would say they're the most important part of this class, the OT, and they'll go through some safety tips for home and a lot more than that. So we cram everything into an hour, but we have plenty of time at the end for questions. And if you have questions, please write them down or try and remember them, okay? So I'm going to share a presentation with you. For everybody that's here in person, I can email this presentation to you after the class is finished, just for your reference. And if this recording works, I can also send you the recording if you really need to see me again. If not, don't worry. All right, let's get started here. Just what I said, what to expect. We're just going to review the whole day and go through everything in the pre-op area and the post-op area as well. Okay. All right. Having a support person, I think, is really important for any surgery you have. We used to call it coach. We're moving away from coach. Coach just sounds like a football coach or baseball coach. That's not what we want. We just want someone to be your cheerleader, right? You don't need a babysitter, but you will need a cheerleader. You need somebody in your corner that's going to cheer you up on days that you're not feeling great. Not every day is going to be great, okay? So the more support you have, the better, right? The more support you have, the better your outcomes, right? The more education you have, the more you read. Just don't go on YouTube, okay? But yes, and it doesn't have to be a family member. You know, your support could be a neighbor or a friend from church. You know, let people know that you're going to have a shoulder replacement. Say, oh, I'm having pretty big surgery in a few weeks. Would you mind maybe checking in with me? You know, asking if I need milk or bread, or, you know, just calling me. You know, some people don't have a lot of family. Either they live in different countries or different states. So, you know, if you know someone that's having surgery, just ask them if they need help, or do you want me to check in with you? So the more help, the better, for sure. All right. Before you have surgery, you're going to have a couple of phone calls from Henry Ford Health. The first one is probably the most important, and that's from the PAT department, pre-anesthesia screening or pre-anesthesia testing. Either way, it's a registered nurse. They work with the anesthesiology team, and their job is to call you about a week, maybe 5 to 10 days before surgery, to go through all your current medications with you. They're going to tell you which ones to keep taking, which ones to stop taking, and when to stop. What I would recommend to you is, if you take more than 2 medications on a daily basis, I would recommend that you write them down, make a list now, so when the nurse calls you, you can write down next to the medication, keep taking, stop taking, and when to stop it, or okay to take morning of surgery. So these instructions are very important. And don't just include your prescriptions, you know, from a physician. Include everything you take. It could be over the counter, like Tylenol, ibuprofen, Bengay cream, Tiger Balm, HRT patches, lidocaine patches, vitamins, homeopathic medicines, just everything. Just tell them everything. CBD oils, creams, gummies, whatever. Okay, so just write it all down. The nurse will go through it with you, and she'll be very specific about when to stop things if you need to stop them. Okay. If there's anything missing, like maybe you forgot to get an x-ray of your shoulder, which I find hard to believe, but if there's something missing, they'll say, hey, you know, you need to get a lab drawn, or go down and get some blood drawn because there's something missing. Yeah. So you just go down and get that done. They'll let you know if there's something missing. We don't test for COVID anymore. That was years ago. Obviously, if you're feeling unwell and, you know, sick the day before surgery or something, please call us and let us know, you know, and then you'll probably be tested, but no need for that. And then probably the most exciting call, this is it. It's the scheduling department. They call you the day before surgery. So if you're having surgery on a Thursday, they're going to call you on a Wednesday, and they're going to give you your arrival time for surgery. And they'll give you some instructions about when to stop eating, when you can drink clear liquids up until what's a clear liquid. So they'll give you specific instructions. They normally start their calls at like 11 in the morning and finish by 3:30, right? And the reason why they don't give you your surgery time is because people can get confused. They're going to say, this is your arrival time. If your arrival time is 5 a.m., that pretty much means your surgery time is 7, right? Because we bring you in a couple of hours before. But the reason why they don't give you your surgery time is we don't want you making a mistake and coming at your surgery time when we're already, well, it's too late, right? So they'll give you an arrival time. They'll give you some instructions about when to stop eating solid food. Write it down. Now, I had surgery here myself, different surgeries, same protocol. And I found it quite useful on my chart. If you have my chart, this is useful. And if your family has my chart, help them find it. On my chart, there is a little menu. It's 3 horizontal lines. You click it, it's a menu. A whole list of things populate. If you scroll down and go to letters, you'll find this whole conversation you just had with a nurse about your medicines and about what to eat, when to stop eating. It's under letters. They put it in my chart, but you have to be an FBI agent to find it. And I only found it because one of the surgeons, their patients told me about it. They were like, oh yeah, you can see all that on my chart. I'm like, wow, I really should know that. An 80-year-old's telling me, a 50-year-old, where it is on my chart, which is quite cool. So if you want to know, you can look at it. And also, if you don't have my chart, when the nurse is giving you your instructions, they'll say to you, would you like me to mail you a letter? Like, remember the olden days, the papers? Yeah, they'll mail you a letter. If you have medications to take the morning of surgery, you might have a certain blood pressure medicine they want you to take, or a thyroid medicine they want you to take. They will tell you to take it. So just take it with some water, right? Enough to get it down the hatch. Okay. All right. What to bring with you to the hospital? Total shoulder replacements are now outpatient surgery. Most patients go home the day of surgery, as long as everything goes well, medically. Most patients do go home. So you don't need to pack a suitcase, but I would recommend maybe bringing an extra set of clothes just in case. We had one patient yesterday, not a shoulder, but a hip, that had to stay because her blood pressure was very high. So we had to keep her overnight to make sure that everything was fine, and she's already home today. But so that sometimes there are circumstances where a patient has to spend the night, and most of the time it's a medical reason. Maybe they feel a bit nauseous or something's going on, or it's like a super late in the day surgery. Either way, most people do go home day of surgery. So wear comfortable clothes, easy to get on. Remember, you're having a shoulder replacement, so baggy clothes, easy to pull over. You don't really need to bring your insurance card or your ID. No one's really going to ask for it. But if you don't bring it, they'll probably ask for it. That's my logic. If I don't bring it, they'll probably ask me. And then my husband's like, I don't know what that looks like. You feel free to bring your incentive spirometer. You should have had this in your safer surgery kit. If you don't have one, don't panic, because we have about 5,000 in the pre-op area, and we'll give you one to take home. All right, and we'll talk about that in a little bit. Shoes that are comfortable. I know OT will talk about shoes, but don't wear any flip-flops or Crocs. They're just not good for us. They're tripping hazards. I would say the most important things to bring on the day of surgery: your support person, glasses if you use them to read, hearing aids if you use them to hear better, and dentures if you use them to chew food. Most important things. If you have a CPAP machine, please bring your CPAP machine into the hospital. And if you don't know what a CPAP machine is, you don't have one. Guaranteed, you don't have one. You would know. Of course, you can bring your cell phone, your iPad, anything like that, but your family will have to hold on to, stuff like that when you're having surgery, like your Apple Watch or, smartwatch or anything like that. Don't wear any jewelry. Just don't wear jewelry. Take all your jewelry off. No hairspray, no bobby pins, nothing metal. It just makes it a lot easier. And then nail polish. A lot of ladies ask about nail polish. fingernail polish. Henry Ford are moving away from nail polish. We'd prefer you not to wear nail polish. If you have to wear it, it has to be clear because we have a little oxygen sensor that goes on your ring finger and we want to make sure we can detect your oxygen. Nobody cares about your toes, so you can paint your toes whatever color you want. We are not fussed about that. All right. So before we get to the pre-op area, the one thing I do want to mention is the only homework we have for you is really to do the class and to take 2 showers before you come for surgery. Okay, 2 pre-surgical showers. Hopefully you have these little scrubs. These are antibacterial sponges. Okay, we'd like you to take 2 showers before you come for surgery. You can either do it the night before and the morning of, or you could do it 2 nights before and 1 night before. It's up to you. Now, when I had surgery here, I did it 2 nights before and 1 night before, and I'll tell you why. Because on the morning of surgery, when you come here, we clean you again with the same soap. So I just thought that is just too much to get up at like 5 a.m., have a shower and come in and do this again. So I spread it out. No one's going to ask you, what time did you take that shower? Where were you? They just want to know you took the showers. So I did mine 2 nights before, 1 night before, came in, did the wipe down. Now the soap is already in the sponge. So what you have to do is just get in the shower, wash yourself with your regular soap, rinse it off, and then maybe put the water off for a bit while you're doing this because you're going to open the sponge and you're going to concentrate on what? Your shoulder, right? You're going to wash your body from your neck to your toes, avoiding your face and your private parts, but you're going to really concentrate on your shoulder, under your armpit, your hands, your nails, everything. Like just pretend you're in Grey's Anatomy, right? And there is also a finger pick in here that surgeons use to clean under their nails. It's a little blue plastic device. Feel free to clean under your nails. You'll be very surprised what you can find under your nails when you actually use this. I was quite surprised. I thought I had very clean nails, and I was like, oh. So let it sink in for a minute and then rinse it off. Once you've rinsed it off, you can turn the water off, come out the shower, use clean towel, fresh, clean towel. Sleep in some clean pajamas and preferably clean sheets too, because you're going to a lot of bother here, right? To reduce the amount of bacteria on the surface of your skin. All right, and then second shower, same thing. Same thing. Because I did it 2 nights, I had 2 towels ready, I had 2 sets of pajamas ready and 2 sets of sheets ready. I just did it in advance because it was just like easier. Okay, it's up to you. You do whatever you're comfortable with, but just do the 2 showers. All right. Now, when you get here to the pre-op area, you'll check in at the concierge desk. They'll show you how to get there, right? The waiting area. The patient will check in. They'll take some information from you, and then your family will sit tight for a little bit and wait because you'll go back. The patient goes back for about 40 minutes to get prepped. We call it prepped, right? We have a lot of stuff to do with you. We don't need your family there. Right, it's a lot faster when you don't have someone saying, oh, sorry, excuse me, right? So the first thing we do with a patient is we take them to a weighing scale. We take an accurate weight of the day. After they've taken your weight, they give you a little tub of mouthwash. They ask you to go into the bathroom to swish and spit the mouthwash, right? That's just getting rid of any bacteria, right? Don't swallow it, doesn't taste good. All right, then they'll take you to a little bed area and everything is laid out for you. Okay, the POA, the perioperative assistant or the nurse, they'll show you exactly what to do. So don't worry about remembering what we're doing, right? They're going to take you through each step. The first step will be to undress, put your clothes in a bag, and use these wipes to clean your whole body, just like you did in the shower. They're warmed wipes. They come from an oven, right? We're not that cruel. There's 2 wipes in each packet, so there's a total of 6 wipes. They even give you a diagram of what a body looks like, which I thought was quite funny. When I had surgery, I'm like, oh my God, really? That do this one on this arm, do this one on your torso, and then your legs. The last thing will be for you to clean your feet. As soon as you cleaned your feet, you're going to put some clean socks on, right? And then your hospital gown. And then you'll just plop yourself on the stretcher and wait for the nurse to come in. Before you sit on the stretcher, the nurse will clean your back. That's the last thing they'll do. Do you need me to help you clean your back? Yes, I can clean my back. So they'll clean your back. And then they'll come in and you'll sit down on the stretcher with your gown and your socks like a good patient, right? Sometimes when I had surgery, the nurse was asking me questions through the curtain. She was like, has anyone ever told you that you snore at night? I'm like, no. What's the other question they asked me? Do you feel safe at home? That's an important question. Do you feel safe at home? What was the other one? Oh, when did you last eat or drink? You know, there's some questions they can ask you, but if you're hard of hearing, they're not going to do it through the curtain. Trust me, right? So you're going to do all that. You're going to sit on the bed. You're a real patient now. You have the gown on and the socks. The nurse will continue asking questions, but she's going to start an IV in the opposite arm. So if I'm having my right shoulder done, the IV line is going to be in my left hand. Okay, left hand. That IV is so they can give you fluids, antibiotics, sleeping medicine. A lot of stuff goes in your IV. On the same hand, you're going to have a little probe. This is called a pulse ox. It's an oxygen detector, right? This will tell us how good your oxygen is, right? Levels of your oxygen. Has a little light on the end, and it's attached to the monitor above you. So we know what your oxygen levels are all the time. And if you want to look at your oxygen level, it's blue, so you can look behind you and you can see it, right? It'll be hopefully above 93%, right? So that's your oxygen. You'll also have a blood pressure cuff. This is a disposable blood pressure cuff on the top of your arm, and that's going to be checking your blood pressure a lot. You'll feel it getting tight. Don't bend your arm, just relax your arm on the bed and it will take it a lot faster. Okay, so that'll be on there. Then the nurse is going to attach some electrodes to your chest, just like when you have a colonoscopy. I know, I've had my first one. These little electrodes, they go on your chest. One on the right side of my chest, one on the left, and then one underneath my rib cage. And those are connected to the monitor to monitor my heart rate. Okay, so that's the electrodes. This one's kind of fun. This goes smack on your forehead. This monitors your temperature very accurately. So in the olden days, we used to just check you all the time. Now we don't have to. It constantly tells us what your temperature is. So if you're in the operating room and you're a little bit too cold, they'll warm you up. If you're a little bit too warm, they'll cool you down. It's pretty cool. You do feel like Pinocchio for a little bit, like you're attached to all these wires, right? All of that will be removed after surgery once you've recovered and you've had some food. But this is just all before and during and shortly after, right? Okay, so that. What else? Well, this is just before you go in for surgery. You're going to have this really fancy hat on. Look at that. Jiffy Pop. That's all I think about when I see this hat now is the popcorn that we used to make. Remember when your parents would say, don't cook that unless we're home? And we're like, really? Do we have to wait for you? My brother's like, the smoke's coming out. You're going to be in trouble. So that's that. So a lot of things, you know, happen and it's pretty fast. It will go really fast for the patient. As soon as that's done, your family can come back and sit with you for the whole time until you go through for surgery, which is nice, right? You can only bring 2 people, and it's just the rule. It's always been the rule. I mean, you can bring as many people as you want to the hospital, but only 2 people can go back. So, you know, if a lot of people want to come, this is what you say to them. You know what? I don't need you on the day of surgery, but I might need you on this day and this day and this day, right? I might need you to make me a sandwich on Thursday, right? So people offer to help, take the help, but you will not need help on the day of surgery, right? All right. We already said this, but try and remove all your jewelry. Your family will wait in the waiting area, and the surgeon, of course, they will either call or come out and see your family to let them know the update of how the surgery went. Now, when you hear from the surgeon, it's a good hour to 2 hours before you see your loved one, right? We let them recover, sleep, wake up, right? And as soon as they're awake and chatting and having some snacks, then we bring the family back. So, you know, as soon as you've spoken to the surgeon, then pop down and get yourself a snack yourself, right? Yeah, and the surgery can take 2 to 3 hours. It really depends. The surgeon will let you know. This is it's a little picture of the pre-op area. It's you know, we've all been in a pre-op area at some point in our lives. A little stretcher, curtain dividing patients. You know, I should probably get some more pictures, but But this is really where you'll put the hospital gown on, you'll do the wipes, and you'll meet the surgeon. Now, the one thing I do want to mention is that you're going to meet a lot of people on the day of surgery, and sometimes it feels like Grand Central Station, like, who's this now? Who's this? You know, the most important thing is all those providers are there for you, right? You're going to see the surgeon. You'll see Dr. Moo or Dr. Kolowich or Dr. Rill. They're going to come and visit you, and they're going to say, what's your name? What's your date of birth? What am I doing for you today? Let's just say you say, oh, you're replacing my right shoulder. They will say, I'm just going to mark my initials on your right shoulder with a skin marker, okay? This little purple pen. So if it's Dr. Moo, she's going to put S, M. If it's Dr. Kolowich, B, K. Dr. Rill is BR. So they'll put their initials. The physician assistant who works with them, whether it's Wade, Melissa, I'm not sure who works with Dr. Rill, but they will come and they will also put their initials on your shoulder. So you're going to see them as well. You're going to see the anesthesia team. The anesthesiologist will come and talk to you about how they're going to put you to sleep. Do you have any questions? You know, they'll know all your history. So you can, you know, if you have questions, ask them when they're in front of you. Who else? Well, you have your nurse that's looking after you and the POA, the perioperative assistant, and the CRNA. CRNA is a certified registered nurse anesthetist, right? They work with the anesthesia team. They sit with you. They're like your buddy, right? In the OR, they go in with you. They sit by your head, making sure you're sleeping. They come out with you, right? I counted a total of 7 providers when I followed Dr. Moo for the day, which is quite a lot. But what you have to remember is if you can't see their badge and you're not sure who they are, ask them, sorry, who are you? I mean, ask them, right? Sometimes our badges flip over. Mine does that a lot. So I have to be aware of that so people know I'm Nikki, right? The providers you'll see on the day of surgery, they all wear the same color scrubs. They're from the operating room. They're from a sterile bin. They're like a greenish color. People say they're blue. They're not blue. They're green. This is blue, right? So everyone, the RN, the POA, the surgeon, the PA, the anesthesia team, they all wear the green scrubs, but they all have a badge to tell you who they are. So, so make sure you ask them. If you're not sure who's who. If you have surgery at West Bloomfield, I'll definitely come and see you. For sure, I'll pop my head in. Hopefully you'll recognize me. If not, I did a terrible job. The nurse will also clean just inside your nose real quick because you won't remember it. But before you go into surgery, they clean just inside your nose with a product called Nosin. What Nosin is a nasal sanitizer. It's like sanitizing your hands. So what we do is we sanitize just inside your nose. So we all walk around with bugs. So instead of like testing everyone to see what we have, we just treat everyone. So it's a little liquid filled ampule and they'll do it for you. They just go just inside your nose and they do little circles like that. It smells nice. It's like orange citrusy smell. And then they'll do it with 3 of these. Unless you work here, and they made me do it myself. Can you believe that? They were like, well, you know what to do. I was like, I'm a patient. You should not be doing that. You should be doing it for me. I did it myself. So you just do little circles. You're going to be cleaner than the day you were born. I guarantee you. The only negative thing I would say about this whole process when I did it myself was my skin was itchy and dry. Don't be tempted to put on any body creams or lotions, before you come to the hospital. Don't do that. You can put face cream on. That was my one question for the PAT nurse. Can I put face cream on? She was like, yes. I'm like, okay. So it just defeats the purpose if you do that. All right. Post-op. Now, before we get to post-op, the one thing I do like to share with you is before you go through to the operating room, everyone's seen you, you have your family next to you, you'll just be chatting, killing time, but it goes very fast. 2 people come to collect you to take you back to the operating room. CRNA and the nurse from the operating room. They're going to come as a team and they're going to ask you a couple of questions like, what's your name? What's your date of birth? What are you having done today? You're going to be like, oh my God, everyone keeps asking me that. That's for a good reason. The CRNA has a little medication in their pocket. I called it magic juice and they were like, don't call it that. I had it, so I know. It's a little medicine. They put it in your IV and it makes you feel relaxed, and also causes amnesia. You don't remember. I do not recall anything after they gave me that medicine until I woke up in the recovery area. So wow, how cool is that? Right? However, you're very cooperative. Right? You won't remember anything, right? You're very cooperative. So when they're moving you onto the table, you'll be chatting away. You will not remember it. I know that because I don't remember anything. And the surgeon that I saw here said, oh, yes, you were very sweet in the operating room, very chatty. I was like, oh, God. But I don't remember, which is great, right? Who wants to remember anything? Nobody, right? You wake up in the recovery area with some warming blankets. How nice is that? Thank you, modern medicine, right? Now, when you wake up in the recovery area, it could be a very similar area that you came into originally, probably a different room number, but you'll be familiar with the surroundings. We will monitor you closely, your blood pressure, your heart rate, your oxygen. And once you wake up, we'll sit you up. Your arm is going to be in a sling already. It's already going to be in a sling, nothing for you to do. And then you'll eventually feel some ice on there too, because we put an ice wrap on your shoulder. So once you're fully awake and asking for some crackers and juice, then we bring your family back straight away, because what they'll do is an x-ray. They'll do an x-ray of your shoulder. We tend to do that before your family comes back, because there's nothing worse than your family coming back and then we're asking them to move to do the x-ray. So we'll do the x-ray. It's a portable x-ray. You don't have to go anywhere for it. It comes to you. And then we'll give you some ice chips, juice, crackers, and then we progress to a sandwich, maybe some yogurt, butter and jelly. We need you to have something in your belly because you haven't eaten since yesterday, right? If you have an allergy or you're gluten-free, you can only have certain snacks. I would highly recommend you bring your own snacks. We had someone that was gluten-free the other day, and I went down to the kitchen. They were like, well, we have fruit cups or this gluten-free muffin that looked like it was like, I was like, yeah, I'll take the fruit cup. I don't think she'll want the muffin. So if you know like things that you like, just bring them. That way your family can bring them back and you can have a really good snack from home, right? It's just a top tip, just because I learned it the other day. So you'll be in the recovery area for several hours. It could be 2 hours, 6 hours. It really depends on you and how you're recovering, right? Most of our shoulder replacements are done early in the morning. Gives the patient plenty of opportunity to work with a therapy team to be able to go home. That's the reason why they do that, right? So when you're ready for therapy, they'll send for the therapist. But meanwhile, the nurse is just going to keep watching you, watch your blood pressure, make sure everything's good. If you need to go to the bathroom, the nurse will walk with you, because remember, you have an IV pole, one arm, right? So we want to walk with you. Don't be thinking you can do it yourself, because you can't. Not in the hospital for sure. All right. These are the things that, one of them you have, right? A sling is a sling, right? The OT will go through all of that with you on the day of surgery when your family are back. Okay, all the education for that. But when you wake up, like I said, you'll be in a sling, have a little bandage on your shoulder. They'll give you specific instructions about your surgeon, what kind of bandage, when you can shower, when it's removed. All of that will be given to you on the day of surgery. You might have some oxygen in your nose. Sometimes patients have it for a little longer, but you might not remember it. But even if you do, it's just a nasal cannula that's in your nose. We take that off. You'll have some compression sleeves. We put these on before surgery, actually, just to prevent blood clots. You'll feel them giving your legs a little squeeze. And then, of course, when you're up and walking, we just tuck this under there and let you walk. And then we throw them away when you leave. Okay. You will have some ice as well, and I'll talk about that in a little bit. Pain after surgery. Of course, you're going to have a little bit of discomfort. You just had surgery, right? Initially, you might not feel anything, but then that gradually wears off, right? So it's very important to let the nurse know the number of pain, right? If they say, what's your pain from 0 to 10? This pain scale I learned in 1991. That's how old it is. Well, it's probably older than that, right? I don't like it, but I still see it in lots of doctors' offices. When you go into a doctor's office, you see this on the wall. I saw it the other day when I was in a doctor's office. I just think it's really useful for children, period. That's it. patients with dementia and children. It's called the Wong-Baker scale. This is the best pain scale. I got this from a hospice nurse about 8 years ago. She showed this to me and I was like, oh my gosh, everybody should have this pain scale. Whoever goes in hospital or to a doctor's office should have this. It's a descriptive pain scale that goes from 0 to 10. But it tells you each one, right? So you know that you might come out of surgery. You might have no pain because you've had numbing medicine. So you might be 0. The nurse says, hey, you a 0? Yeah, I'm 0. I can't feel anything. Well, yeah, because you're numb. That's going to wear off, right? But not like all of a sudden you'd be like, it's getting my attention. If it's getting your attention, let the nurse know straight away, hey, I can feel something now. It's getting my attention. She'll say, well, what number is that? And you'll say about a 3. It's getting my attention. Something's going on. The most important thing for you to know is be very smart controlling your pain, right? Use the ice that we provide you. We're going to give you ice packs, a shoulder wrap. Use the ice, of course, but also take the medicine that they give you and maybe try and schedule it. That way you're keeping a lid on any pain, right? Don't just not take anything and think, well, let's just see what happens. That's not a smart way to do it. Just try and make sure you have a little schedule. We never want anyone to be 10 out of 10 because 10 out of 10 is literally unconscious. We don't, no. Okay. But this is a great pain scale. I highly recommend you sharing this with family, friends. Someone's going to hospital, print this off, say, here, take this with you. Because it's very hard. When you go to a doctor's office and they say, what's your pain? From 0 to 10, you're like, I'll have no pain. Do this. 8, it's high, right? It's hard to describe pain. It's just very painful. But when you look at this and you go through each number, you'll find where you are, right? When you stub your toe and you're like, you'll find where you are if you look at that. So yeah, share it. I think it's a great pain scale. They'll send you home with medications, but the nurses will go through that in the discharge area when your family are back. Your medications will be delivered to the bedside when your family are back. Notice how I keep saying family? Because you're not going to remember half the stuff the nurse says, because I did not. My husband's like, don't you remember she said you're supposed to do this? I'm like, nope, don't remember a thing. Little bits here and there. That's why we have your family, and that's why we print everything in an after visit summary. Every time you go to the doctors, they give you papers and you put them in the back seat and you never look at them again. Oh, these papers are going to be thicker and important, so keep them close because they'll have important information about your future appointment with the surgeon, your outpatient appointments if you've made them, right? Because I know that some surgeons want you to make that appointment, right? So do that. All right. Preventing blood clots is important with any surgery. Even when you have a baby, they tell you to get up and walk around. Just drink plenty of water, take some deep breaths, use your incentive spirometer. This is a little device that kind of encourages you to take deep breaths in. You can, right? You're exercising your lungs. You don't want your lungs getting lazy. Lungs get lazy. You don't want an infection, right? You don't want pneumonia. You don't want blood clots, all right? You can do it without this. You could just sit on your sofa and what you're doing is you're naturally forcing your lungs up and out and they recoil back and down. So just try and do that, especially the first few days after surgery. You're feeling a bit like, take some deep breaths, exercise your lungs, right? Try and get up and walk every hour. There's nothing wrong with your legs, right? I know sometimes patients are like, I just can't get up. Why? What happened to your legs? It's your shoulder you had surgery on. So try and make yourself kind of get up and walk around the house every hour during the day. Just keep things moving, right? Keep your body motion. Go, 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 right? You don't have to do like sprints. Just walk around the house, go to the bathroom. We know we need to do that. Incentive spirometer right there. If you don't have one, do not panic. We will give you one on the day just to help you take some nice deep breaths. This is probably the most annoying thing about having surgery, period, is constipation. If you know, you know, right? You can become constipated pretty fast from dehydration, you know, pain pills, just not moving all day, even in surgery, right? Things slow down. Now, they'll most likely give you stool softness to take, but I am my own advocate when it comes to constipation. I know what works for my body, so I'm going to do what works for me, right? Yeah, sure, I'll take the stool softness, but I'm a big water drinker. I eat fresh fruits, fresh vegetables. Kiwi fruit is a great laxative. Some patients tell me prune juice is great when you warm it up in the microwave with melted butter. Yeah, that's true. It works. Take it like a shot. It works. But there are things that you can buy. I used Smooth Move tea. This tea up here. You can get it everywhere. I got mine at Kroger. It does work. It's a laxative tea. So please be careful. Don't put it with your regular bags. Right? Keep it separate in the medicine cabinet. But it does work. You know, and if you take it at night, like make it real strong, sip on it, let it work its way through your body, and then hopefully in the morning you'll have a regular bowel movement. Constipation is very painful. We don't want you to get constipated, so just try and be proactive if you can. We mentioned this already, length of stay. Most people go home day of surgery as long as everything goes well and you pass your OT. All right. Just make sure your coach is there. Of course, they're going to be there. They're going to be with you. But if you have to spend the night for any reason, make sure that your family are there by 8 a.m. the next morning, because the OT can come as early as 8 and you can be discharged as early as 10, right? So that's if you have to stay, but most people do go home. But you know, just have your family there. Discharge instructions, I already mentioned the AVS, after visit summary. They'll go through everything with you, all your medications, when to restart your home medications, which medications you're going home with, when to take it. It's a lot of information, but that's also in my chart as well, which was nice. I saw my after visit summary in my chart as well. These are the telephone numbers if you didn't know them already. I'm sure you do know them, for the surgeons, total shoulders. Just remember, you know, make your follow-up appointments, you know, with outpatient physical therapy. If your surgeon says do it, right? And then that's their telephone numbers should you have any concerns, okay? All right, let's get to the best part, which is OT. I'm going to quickly share with Raj how this works, just because they gave us a new keyboard.
Oh, great.
So we're recording it as well, just because the lady can't get on video.
Okay.
So this one is for this one,
Mhm.
and then down is for this one.
So don't need the mouse.
Nope, no mouse. You can just press down.
Down. Okay, that's
Yeah.
going to be a challenge.
Do you want me to do it for you? Do you want me to hang out with you?
Eventually, figure it out.
Okay.
Down.
Down is next. Yeah.
Down is next.
I'm sure you can use a mouse, but I'm not that smart.
Me neither.
Okay.
Hi. Hello, everybody. My name is Rajni. I'm one of the occupational therapists here. And chances are you might see me as your occupational therapist after your surgery. If not, there are other occupational therapists you'll see. Typically, if your surgery is early enough in the day and you have recovered after the surgery, the nurses keep track of it and they let us know, they inform us about, you know, where you're at with your recovery after the surgery. And if you're able to participate, we do see you on the same day of the surgery. If the only time we wouldn't probably not see you the same day is if you came out of the surgery, like it was later in the afternoon and you're not still ready, or if after surgery, and some people have reactions to the medications, the anesthesia, the surgery, they might not be, like they might have low blood pressure, they might be dizzy, they might be throwing up. If there are things like that that happen, then we will kind of monitor you and not, you know, therapy will not be the main focus of your recovery at that point. So if that's the case and you're not seen the day of surgery, like Nikki mentioned earlier, the occupational therapist will come like between 8:30 and 9 at the latest in the morning. So whoever is designated to be your person who takes care of you or takes you home or whatever, we recommend that that person is there by that time. So whatever instructions we're giving is also, you know, followed by them. And especially with how to manage the sling, put it on, take it off. Generally people need an extra hand, so we always like to have the person helping you at home also understand and get comfortable on how to put the sling on and take it off. Typically, you will see an occupational therapist after surgery. The only time you would see a physical therapist is if you have trouble with mobility, like walking. If you were already using a walker prior to the surgery, and now after the surgery, you may not be able to, hold the walker with both hands. You may need some alternate device like a cane or a different kind of walker. Or if when the OT sees the patient, we find that you're very unsteady, you're shaky, you're not moving well, there's a risk of maybe not being very stable on your legs, then we will recommend that a physical therapist also see you for making sure that you're safe with your balance and mobility. But yeah, if you're moving fine and you're not having any trouble with mobility, you wouldn't need to see the OT. PT right after the surgery. That'll come like when you're ready for your outpatient therapy. So the occupational therapist will go over what your precautions are, what you need to follow for depending on the surgery and the surgeon. There are different protocols, and we'll make sure you get instructed on what your specific precautions are, how to get dressed, do your bathing, toileting, grooming, the activities of daily living that you would need to do while maintaining the precautions with having the sling and not being able to use that arm, how to manage the sling. And then there are certain exercises that you'll start doing. Usually it's the day after the surgery, but we have a protocol. Again, we'll give you the handout with the exercises listed and when to start doing them and how to do them. All right, now I should remember this. And down. Yay, that worked. All right, precautions after surgery are you do want to wear your sling as recommended by your surgeon. And again, based on the surgery and the surgeon, there are different time frames like you would need to wear it for. But the main thing is to make sure you're wearing it while you're sleeping always, because you do not want to like accidentally roll over onto that arm or have that arm move around on you when we're sleeping. So just have that sling on while you're sleeping. Avoiding sudden movements is just to make sure you don't like cause any jerking or arm kind of moving in a way that might cause you pain or discomfort. And using a small pillow or a towel behind your elbow when you lie down or recline. The reason for that is that we want the sling, your arm in the sling, to stay parallel to your body. We do not want the arm going behind you or going too far forward in front of you. The sling will keep it in place. But when you're sleeping, especially if you don't have anything behind the back of the chair or the bed and the back of your arm, the arm may slide back. So you just want to put a pillow or a towel to fill that gap in between the back of your arm and the back of the chair or the bed, so it's supported in the back. The do nots are, we do not want you to actively move your shoulders. So active is you trying to move the arm in any direction. Passive is if somebody else moved your arm and you're just going along for the ride, or you use your other arm to move it. You're just not engaging these muscles. You're letting somebody else do the action. Do not allow the arm to move behind your body. So like I was saying earlier, we don't want it going behind you. We just want you to stay right parallel to you. We do not want you to go away from you. So when your arm is like this in the sling, you are able to bring it straight like this, which is what we call a handshake position. You can bring it straight like this. We just don't want you going away from your body. So you can come up to here, or it can stay against your body. Do not put any weight on your operated arm, especially like when you're pushing up to get up or when you're getting in and out of bed. So one thing we say is that if you're going to be sleeping in your bed, try not to come out on the surgical side. So you want to come out on the non-surgical side. So if you need to change your position in your bed, you may need to practice doing that because you want the surgical arm to be on the inside of the bed, not on the outside, the side that you come out of. Okay? And when you're getting up, if you use your hands to push up, to stand up, you only want to use the non-surgical hand to push up. You won't be able to push on this arm. And you don't want to lean onto that arm or push down or roll onto that side. And this is as long as you're required to maintain the precautions. Again, the surgeon will tell you whether it's for 4 weeks, 6 weeks, however long they tell you. Do not lift anything heavier than a coffee cup. So if the way the arm is going to be in the sling, your hand's going to be free to hold on to objects. Like you can hold a phone, you can hold a cup, you can hold a toothbrush, you can hold things, just nothing heavier than a coffee cup. Like, if you need to hold something while you're opening a door, or if you're holding this toothbrush while you're putting toothpaste on it, you can use this hand for things like that, but not anything heavier than a coffee cup. And no driving until you're cleared by the surgeon to start driving. And typically, as long as you're wearing a sling, it won't be advisable to drive. Activities of daily living. The next few slides, we will go over tips for activities of daily living. The basic ADLs are eating, dressing, grooming, using the toilet and bathing. And the advanced ADLs are tasks like preparing meals, doing laundry, housekeeping, shopping. So for the advanced ADLs, now remember, since you're going to only have one arm to do things, some of these tasks may be hard, like preparing meals or like, doing the laundry or cleaning, vacuuming, things like that. So not bad idea to plan ahead, especially if you live alone, maybe have some frozen meals or meals that are already prepared and in the refrigerator that you can just need to warm up. So you're not having to make meals from scratch. Already like do all the laundry and cleaning. So you're not, having to do things right away. And then maybe in a week or two, when you need to do it, you have already arranged for somebody to be there to help you with these tasks. If you need to go like to the grocery store or to the doctor's office or anywhere like that, arrange for someone to be there, your driver for you, so that you're prepared for it. It's always a good idea to arrange for extra help and then call them to tell them that you may not need them if you don't need them, versus like trying to scramble at the last minute. So that's why we give you the list of things that you may need to have some alternate arrangements for, like, the housekeeping, the laundry, the preparing meals, the shopping. And also, if your surgery is on, if your right arm is free, have things arranged on that side, so you're not having to reach over to grab things with your non-surgical hand, because that's when you may lean over onto this arm. So, put things close enough. Or if you have an upstairs and downstairs, maybe have your snacks and beverages upstairs so you don't have to come up and down multiple times. Just kind of plan ahead for these kinds of things. For eating and grooming, you will need to use your non-surgical arm. So if you're having surgery on your dominant side, you may want to practice eating with your left hand, or, eating food that you don't have to that you don't have to need two hands to cut and chop and stuff. Brushing your teeth with the non-dominant hand, combing your hair with the non-dominant hand. So you're not, practice it so it makes it easy for you. Also, you can use the surgical hand to stabilize, like I was saying, maybe hold on to a jar while you open it with the other hand, or hold on to a toothbrush while you're putting the toothpaste on, things like that. Excuse me. The getting dressed, the upper body dressing, the therapist will specifically go over how to remove the sling, how to put the sling back on, how to get your shirt on, things like that. So depending on the surgery and the surgeon, there are different types of slings. Some are very easy to get on and off. Some, have a few extra buckles and belts and stuff. So we will practice that, have you practice that, have your person helping you practice it so you understand how to do it. You will be removing the sling to get your clothes on, when you're taking a shower, when you're doing certain exercises. So plan on doing these things like one after the other, so you're not having to remove the sling multiple times throughout the day. Just, once in the morning, you take the sling off, maybe do your exercises, take your shower and get dressed. Same thing at nighttime. You'll do the exercises a couple times a day. Shirts that button up in the front are going to be easier to put on and take off, or really oversized shirts, like if you're wearing a t-shirt. So it's easy to like slide the arm into the sleeve. And also the oversize is also because there might be a bit of swelling there. You don't want it too tight that, your arm is being, you're dragging it in, or you feel the tightness under your armpit or something. The surgical hand you can use to like stabilize the shirt if you're buttoning or if you're putting zipper on or something, but you won't be able to like use it to pull the other arm in. So typically what we say is get dressed on the surgical side first. So you can either like bend over and let this arm dangle, or you can sit down and let the arm dangle, slide the arm over, bring it around, get the other arm in, then button. Lower body dressing, we always recommend that you sit down and get dressed, and usually pants that don't need to be buckled or zippered or buttons and stuff. Pull on pants are easier. And also know that when you're pulling them up over your hips, you'll be able to get it on the non-surgical side, but reaching across might be a little challenging, so you don't want it to be too tight fitting or something that's hard, especially like if you have to, go to the bathroom, you want to be able to slide it down more easily so you're not struggling to pull your pants down. If you're in a hurry to get onto the toilet. If you need any equipment as far as getting, oh, I forgot to turn that part off. Sorry. If you have trouble with getting your pants on and off, there are some equipment that we can recommend, or if you have a family member who can help you, we would suggest that they help you. But again, the therapist will go over what is, what your challenges are and give you the appropriate recommendation for that. You should get a handout with all this. If you have not, we also give you, I think Nikki sends you an email with the information. If you haven't gotten it, the therapist will also give you another handout when you have your surgery. So you will have plenty of visual information as well. The next slide is about using the toilet. Like I was mentioning earlier, pulling the pants up and down, you just want to use your non-surgical arm. And also wiping yourself, you will be using the non-surgical arm. So if you have to switch, not a bad idea to practice before the surgery, just to know how to reach and wipe yourself after toileting. So it's not as awkward as it can be when you're not used to doing it with that arm. Give yourself plenty of time to use the bathroom. It will take you a little longer than normal after surgery. You may want to consider wearing a pad if you have urgency or any kind of, problems with incontinence, that you're not like trying to rush and, having accidents or anything like that. If you have difficulty sitting down or getting up from the toilet, especially since you can't use two hands to push up, if that's how you were doing before the surgery, we may recommend some equipment like a raised toilet seat or toilet safety rails like these, or just grab bars installed in the wall. If you already have them, that's well and good. If you're struggling and you may want to consider getting that before the surgery, that's also not a bad idea. But we will again make all these recommendations for you based on how you do after the surgery. the main thing is we do not recommend that you use the toilet paper holder or a towel rack to push on because those are not sturdy enough to hold a person's weight. So you do want like a designated grab bar, or sometimes just a raised toilet seat makes it easy, or these kind of safety bars are also not a bad option. For bathing, you can take your sling off to bathe. You do want to keep your arm in the right position. The right position is either just letting it stay against your body like this, or you can just let it hang down by your side. So what we say is you don't want to move the shoulders. So if you just let your arm hang down, you're not moving the shoulder. The movement was coming from the elbow going down. So that is okay to do. You may need a long handled brush or a sponge for, like, again, you will be able to use a non-surgical hand to reach wherever you can, but you can't use this arm to reach places. So if you need to have like a long handled brush or a sponge to reach places that are difficult to reach, that's not a bad idea. Typically you should be able to stand to take a shower, but if you have like issues with stamina or balance, or if you've already been using a shower chair before the surgery, then continue to use it. We always recommend that there is somebody there to help you or just be there for you the first few times you're taking a shower. So always, if you, especially if you live alone, make arrangements for someone to come to help you with your showers on your shower days. Non-skid surface or rubber mat in the tub or shower just for as a slip prevention, and having a bath mat outside the shower so when you step out you can dry your feet off so you're not walking on wet feet. Again, these are all fall prevention methods that, just to be cautious. Um, you will not be able to get into the tub for a bath as long as you're following your precautions. Again, the surgeon will let you know when it's safe for you to do that. So it'll be showers or sponge bathing or whatever you prefer until they allow you to do the bathing. The bathroom equipment, these are generally not covered by insurance and it's not usually needed. And if they're absolutely needed, we will make those recommendations. So we don't just recommend equipment if they're not necessary. You can also consider borrowing them from friends or family because some of them may only be temporary. You may need it for a few weeks and then you don't need it. Or you can find them at local senior centers, Lions clubs, churches, fire departments, or thrift stores. Or else you can always purchase them on Amazon or any medical supply place. But these are some other options if you don't want to outright purchase equipment that you're not going to use for too long. These are some of your arm exercises. Again, the occupational therapist will review and have you practice it. So you know exactly how to do them, when to do them, and how many times and all that. These are called the distal exercises. They are mainly for your elbow, your wrist, your hand, your forearm, just to keep them from getting stiff, because when you're in the sling for like long periods of time, the arm will get a little stiff if you don't move it. So these are just to keep the range of motion. They're not like, you're not trying to strengthen or build muscle. You're just trying to keep the range of motion, the joints limber. So elbow is coming up and down. That's one. The forearm is just churning back and forth from the elbow. So you're not moving the shoulder, just the forearm moving back and forth. The wrist is just either going back and forth like this or up and down like that. And then the next one would be for the fingers, opening and closing your fingers. And some slings come with a little squeeze ball attached to them, and you can use that too. Or if you have a small, like a soft gripping ball or something, stress ball at home, you can definitely do that as well. The pendulums, these, again, depending on your surgery and the surgeon, you may be able to start the day after surgery, or some surgeons tell you to start like a few days later. And again, the therapist will review that with you. These are not active movements. They're using momentum and gravity to help you move the shoulder. So you're going to be holding on to something solid, and you're going to like kind of bend over and let the arm dangle. So if your arm comes out of the sling, you just let your arm go to your side. You hold on to something solid and you bend over, and then you're using your body's momentum. So you're rocking forward and back or side to side, or you doing circles. So I'm going to come here and show the people in the video if you can see me, and then I'll come out there and show you guys so you can see me. So you're bending over, and then you're going to rock your body. I'm not swinging my arm, I'm just rocking my body forward and back, side to side, then circles. Okay. So you guys, you just want to hold on to something solid so you don't, when you bend over, you're not feeling lightheaded. So you take the sling off, come down like this, bend over, and you're going to rock your body. So the arm just sways along like a pendulum. You're not swinging my arm, just moving my body, and the arm sways along. The sideways is to go from one foot to the other, and then circles clockwise. So it's all movement of your hips and your lower body that's just allowing the arm to sway along. Okay. Again, the therapist will have you practice it or demonstrate it so you understand how to do it. And depending again on how your balance is, how you feel, like, when you bend over, if you get dizzy or lightheaded or something, you don't do it if you're not feeling good. Okay. You only do it if you feel comfortable doing it, because this is a little challenging and not everybody may feel up to doing it. So again, we will definitely make you the right recommendations for you based on how you do after the surgery. Oh, I did that. There we go. Home safety and helpful tips. Just some general information on home safety: removing throw rugs, clearing the floor of clutter and cords or any tripping hazards. Make sure you have a well-lit path at nighttime when you're getting up and moving. So especially going to the bathroom, putting items that you use a lot in easy to reach places, so preferably on your non-surgical side. And a lot of patients find it more comfortable to sleep in a recliner the first few days, weeks after surgery. And your surgeon may also sometimes give you that advice. So some people get recliners. If you don't have recliners, that's okay. If you have an adjustable bed, that's also a good option. Or a wedge, like a wedge that goes in the bed that prop you up, or lots of pillows to prop you up. It's not going to feel comfortable to be flat on your back. If you're sleeping in a bed, sleep in the side of the bed where your surgical arm will be on the inside or the middle of the bed, so you're not tempted to push on that arm to get out of bed. Stair safety. Using stairs may be a little difficult, especially if you've had trouble before. If your bedroom is upstairs, consider staying on the main floor if possible. Like, especially if you're going to sleep in a recliner and that's on the main floor, that solves that problem. Consider installing a railing on both sides so you can use the non-surgical arm to just go up and down. Consider, or if you don't have trouble, we can always demonstrate it, and your railing is on the surgical side. You can go sideways where you're facing the wall, facing the railing, holding on with the non-surgical side and going up one step at a time. So there are many options to do the stairs if you have trouble. If you don't have trouble, you don't even have to worry about it. But there are definitely lots more options about how to do the stairs safely. And we will practice that with you before you go. Activities after surgery, you will find that your endurance is a little low after the surgery. And so just take it easy, but don't be too sedentary. You do want to get up and move as much as possible. Your limitations are going to be the pain, if you feel the pain, precautions, and some medications that can make you extra tired or maybe a little lightheaded. So just be careful of these things, but don't limit yourself and don't just be like a couch potato. You can get up and move. Just know that you may not be able to like go on a long trip or go for a party or something right after the surgery. But just generally taking care of yourself at home should be okay. And there are some patient stories. This is the link. Some people have, given their experience on how they recovered from the surgery. If you want to look at that link and read about some people's experiences, that's just to get an idea. That's an option. And that's it. If you have any questions at this point.
All right. Thank you, everyone.
Anybody have any questions?